The Industrial Revolution was a period of profound scientific discovery in America. New advancements in steam engines allowed for people to cross the world in record time. Telegraph communications revolutionized how information was spread, making it more accessible than ever before. Factories centralized production and made products more readily available. However, these innovations came with a cost, as rapid urbanization and industry introduced new dangers to health. Cities were primaries for infection, bringing people closer to each other than they had ever wanted to be before. And the inescapable stench that permeated the air served as a reminder of the lacking waste management systems. In the past, this had been a huge issue. Old medicine consisted of pseudo-treatments and procedures that included, but were not limited to, cocaine drops for toothache, leeches for bloodletting, and the injection of toxic heavy metals to cure a fever. Innovative scientific tools and the realization that new, effective remedies were needed to avoid a black plague in cities sparked a new era of medicine. The introduction of germ theory, or the idea that microorganisms known as pathogens or germs could lead to disease, provided the foundation upon which modern medicine could be built. Science-based procedures like pasteurization, implementation of proper hygiene, and vaccines would eventually lead to the average life expectancy rising from 47 in 1900 to 80 in 2008, according to National Vital Statistics reports. However, the most impactful advancements to come from the push in medicine are the development of new, common drugs like penicillin and aspirin. These miracles of modern medicine have been created only because of aggressive investment by American research institutions. According to the New England Journal of Medicine, the United States comprised of 51% of global research spending, at $131 billion in 2007. However, since the American healthcare system is based around free market principles, pharmaceutical companies have a monopoly over their research, often resulting in the consumer paying a price. Because of this, government regulation must be implemented to prevent Big Pharma from abusing its consumers with excessive drug prices.
Personally, I am concerned about the cost of the drug. If it is too high, many will not be acceptable.
There are cases where they are clearly just taking advantage of the law, of the patent law, or taking advantage of lack of competition. And the two I can think of the top are the EpiPens.
1 in 50 Americans have a form of anaphylaxis or a life-threatening allergic reaction. After agitation, if not treated right away, it can result in unconsciousness or death. Immediate treatment is vital with severe allergic reactions, which is why an estimated 3.6 million Americans were prescribed an EpiPen in 2015 as a quick and portable remedy for anaphylaxis. However, since Mylan took over the EpiPen industry, prices for these indispensable lifesavers have inexplicably risen.
Mylar was one when their competition went out of business. There used to be other brands. They raised their prices, 300%, even though they were using the same factory.
This has put Americans in a dilemma, having to either pay a proverbial arm and leg for a life-saving medication for their children or themselves, or to have to risk death every time they walk outside. And there isn't a clear reason of what could have caused this price hike. The formula for epinephrine has remained virtually unchanged, and no supply chain or production issues were introduced to suggest a rational cause for this wild swell in cost.
That's obviously abusing the American public for no reason whatsoever.
Turing Pharmaceuticals and its CEO Martin Shkreli is a far more extreme example of corporate greed for power. In the fall of 2015, he abruptly hiked the price of the toxoplasmosis drug Daraprim by 5,000%, from $13.50 per pill to $750 per pill. The medicine treats a relatively rare parasitic infection that often strikes babies and HIV/AIDS patients, a group that is already vulnerable to disease. The move was wildly unpopular, to say the least, and Martin Shkreli would later justify his actions by saying in an interview with CNBC the following:
"There's a lot of people who die of toxoplasmosis every year, and this field desperately needs new ways to treat toxoplasmosis. For instance, the current drugs right now target the folate receptor of the bug. There's no other way to kill toxoplasmosis as of right now. So we're working hard on trying to find new ways to do that.
However, patients don't need a new toxoplasmosis drug as urgently as Shkreli claims. He ignores the fact that although the price hikes will allow Turing Pharmaceuticals to develop a future drug that has a higher success rate, the price surge of the current one will leave many without a treatment. The very people that Martin Shkreli claims to want to save are dying because of his decision to, quote, make the most profit for his shareholders. Those suffering from asthma attacks before the 2000s had two choices in treating flare-ups: an inhaled steroid or a long-term bronchodilator. Both are daily preventative medicines and by themselves do a subpar job. But in 2001, a new product was introduced by GlaxoSmithKline, which combined the two drugs to produce a more effective and longer-lasting inhaler called Advair.
I have asthma. I've always had asthma. And Advair was the first, as I recall, the original combination asthma medicine that had what's called an inhaled steroid plus a long-acting bronchodilator. Bronchodilator is the inhaler you use so you can breathe. So it had two things. And they were always expensive, and at first they were the only product on the market. And then other products came out, and there were no generics, so they were all brutally expensive.
According to Bloomberg News, Glaxo justified the steep price surge by saying that their product was extremely difficult to research and develop, and that the company needed to recoup their costs. While generic copies of the inhaler do face hurdles and regulation to this day, this was a blatant exaggeration and did not justify excessive prices that the corporation had demanded, especially after considering the popularity of the drug. Since 2001, Advair has raked in about $100 billion in sales for Glaxo and is the fourth largest US seller over the last quarter century. Millions of Americans have relied on this drug to keep asthma attacks at bay, and even though GlaxoSmithKline has clearly recovered all its R&D costs, Advair has remained expensive. Despite attempts to keep Glaxo prices high, it was forced to be sold more cheaply as other inhalers entered the market, to the relief of its users.
Advair finally lost their patent this year, and their price dropped by about 60%.
However, patients in other sectors of the medical industry have not seen the emergence of generic products. Vermox is another instance of money coming first, with consumers coming second.
There's another product that's used for pinworms, which is a minor illness called mebendazole, and it was on the market forever on a product called Vermox. It was old, it was cheap. Vermox went off the market. They decided they weren't making enough money.
Vermox initially sold for about $10 to $30 per pill. Since then, the patent for the drug expired, and Impax Laboratories bought it up and sold it as Imverm at an enormous markup.
At Target with the coupon, 2 pills are $778. At HEB Pharmacy, $872. Walmart, $890. So this is in an app called GoodRx. But obviously this product was on the market. We used to write it when it was the original, when it was Vermox, dirt cheap. We used to write it all the time. In fact, I didn't even make you come in. If you called and said, your mom called in and said, I think Ben has pinworms, it was just cheaper to call in Vermox. Well, not anymore. That it's $900 for 2 pills. Yeah. So there's an example of where they took advantage of the law. They're the only one that brought it back out, and they're making a ton of money.
The insulin market isn't doing much better either. When Frederick Banting discovered insulin in 1923, he refused to put his name on the patent, feeling like it was unethical for a doctor to take profit from a discovery that would save lives. Banting's research partners James Collip and Charles Best would go on to sell the insulin patent to the University of Toronto for a mere $1. They wanted a life-saving medication to be available for everyone. Despite their noble intentions, their drug, which 30 million Americans with diabetes rely on, has since become a prime example of price gouging. 4 of the most popular types of insulin have tripled in price, resulting in the doubling of out-of-pocket prescription costs. According to Vox News, the average price of insulin rose to $450 per month in 2016, and is only going up. The rapid increase in cost has led to 1 in 4 people skipping life-saving doses, who then face kidney failure, blindness, or even death. Insulin manufacturers claim the increases are just a price tag that comes with innovation, but the price surges associated with insulin have not been in step with the incremental improvements that the research companies have provided. It's impossible to conclude that the new insulin are 20 times better than the old ones, yet corporations continue to raise the cost at the same rate. Not only that, American patients have disproportionately bear the brunt of these price hikes. The real reason why these price increases have taken over the US market is because of the lax regulatory environment around drug pricing. In European countries, the governments negotiate directly with pharmaceutical companies over the maximum price of the drug. America has taken a more laissez-faire approach to pharmaceuticals. Drug companies haggle separately over drug prices with a variety of private insurers across the country, which gives Big Pharma more leverage. Meanwhile, Medicare, the government health program for those over 65, which is also the nation's largest buyer of drugs, is actually barred from negotiating drug prices. What's happening in American pharmaceutical industries, in short, is a market failure. Supply has failed to meet the demand as drug companies have collectively fixed prices for their own personal gain. This is evident when comparing the costs for insulin formulations. As shown in a graph produced by Fair Access Medicines, the insulins Lantus and Levemir, despite being produced by two separate companies, has been extremely similar in price since May 2007. Another graph shows how Humalog and Novolog, two similar insulin formulations manufactured by Eli Lilly and Novo Nordisk respectively, have risen in price at the same rate. It's clear that the free market principles have failed in the pharmaceutical industry, as drug titans cooperate with each other and take advantage of the lax rules to satisfy their bottom line. Human beings are dying because they cannot pay the outrageous prices that these companies have come to demand. According to an article published by the Brookings Institution, the United States consumer spends roughly 3 times more on drugs and about 3.5 times the price per dose of medicine taken than their European counterparts. Even when accounting for higher US incomes, Americans spend 90% more proportionally to their income. In short, people cannot pay for their health, even with insurance. Clearly, something needs to change in the American healthcare system to make it more consumer-friendly and affordable. Though it is a complicated problem, there is a general consensus on what should be done about the abuse by pharmaceutical corporations.
I think we should balance between regulation and free market principle.
But the form that this balance may take is hotly debated.
There could be a commission, nonpartisan, that you could turn in what you think doctors, consumers could turn in what they consider an abuse of pricing, Vermox, again, EpiPen, and they could have some authority to go to the company and say, we expect to see some improvement here, we'll take action.
These actions could include fines or denial of government grants. By hitting companies in their bottom line, the Commission would have the best chance for reining in these predatory corporations. Alternatively, the rights to patents could be ended sooner. Current laws protect patents for 17 years, but the sheer length of time has been called into question.
So, do you shorten the patent law? For example, 17 years too long. What if you let people have a patent for 7 years? That gives you a chance to recoup your expenses.
Pharmaceutical corporations, under modern drug laws, can license its patents to generate more revenue without any innovations to the product.
So let's say I'm making a pill, and I'm getting $100 a pill for it. It's only cost me $10 to make it. I can sell it to company B for $60. And if they want to market it and bring it out for $80, so that I'm okay with that, because that's not really undercutting my price. So, but the patent law protects them and allows them to do this. So shortened patents would be one.
Finally, the American government could just introduce more competition in the form of foreign governments.
Bringing in equivalent products from other countries. There's Advair in Europe. There's Advair I use Advair because I know that one. There's Advair in Canada. There's Advair in Mexico. What if we allowed you to mail order? There could be an approved list of products that can be imported from other countries. That would make the price plummet overnight. So I think there are ways to control. So open up competition from other countries that you think have reliable products. You could even make them one reason countries don't do that, the FDA is hard to get through. So you'd have to come up with a process that if you have approved a product approved by the German FDA, the U.S. FDA could have a shortened process. So we could have a much short, bring the information you provide the German FDA. We could look that over, and if that's sufficient, you could move ahead. If not, we might ask for more data, but you wouldn't have to make them go through the whole process again. And that would encourage countries, pharmaceutical countries around the world to market in the U.S. because we have 350 million people. That's not the biggest country in the world. India has more, China has more, but the fact is, that's a huge market if you have a product approved in Germany and you can now start selling it in the U.S.
By adding foreign competition, prices would inevitably decrease and innovation would be encouraged.
So there are ways to bring costs down, but it's going to have to start, again, as a rule, I believe that there's plenty of government in the United States, but I think this is where some of the government's going to have to take the lead.
The current American healthcare system is flawed. Although it does promote innovation in the pharmaceutical industry, it doesn't make these new drugs accessible. From EpiPens to insulin, it's clear that these corporations act in the interests of their shareholders, rather than their patients. More must be done to regulate the control that Big Pharma has on prices to allow consumers to take better control of their health.